Cardiovascular disease is the #1 killer of people around the world. Lately, there's been a rash of deaths in bodybuilding, most of which are related to cardiovascular problems. Uh, it's hard to say what caused this. I mean, I don't know the details of each case, but I do know that the people that succumbed to cardiovascular complications died at a relatively young age. And this raises the question of what can you do to help prevent cardiovascular disease. And I should also point out at this point that one of the things that determines longevity, obviously if you get a heart attack or stroke, your longevity is going to be cut short because you could die or become incapacitated. But one thing they've noticed in people that live to 100 years of age or older is, especially if they keep their brains, in other words, they don't get brain degenerative diseases like Alzheimer's or Parkinson's. Most of these people are in unusually good cardiovascular health. They tend to have higher levels of a protective form of cholesterol or cholesterol carrier called high-density lipoprotein, which I'll be discussing a bit in this video. So it's very important. But to understand the best way, well, let me just say, the best way to prevent, from speaking generally, the best way to prevent cardiovascular disease is to adopt good health practices. This includes regular working out, both weight training and aerobics. You have to do both. Weight training helps a lot, but if you really want the full benefit of cardiovascular protection, you have to include an aerobic component. You don't have to go crazy on it. You can do high-intensity interval aerobics. They take no more than 20-25 minutes. Or you can do the regular steady-state aerobics for about 30 minutes, 3 to 4 times a week. That'll cover your cardiovascular exercise and, of course, the weight training along with it. Of course, you also want to follow a good diet. I'm not going to get into the dietary aspects of cardiovascular disease prevention here in detail because it's extremely complicated and it takes a long time. And I discussed this in my Applied Metabolics newsletter in extreme detail. Suffice to say, the best diet to prevent cardiovascular disease remains a controversial topic. The usual recommendations given out by organizations like the American Heart Association, they talk about minimizing the intake of saturated fat. However, the saturated fat issue remains extremely controversial because the studies that have looked at the relationship between saturated fat and cardiovascular disease onset have not shown any particular relationship. There is a greater relationship between the intake of processed carbohydrates or high glycemic index carbohydrates, in other words, fast absorption carbohydrates. They do seem to adversely affect heart function and also the process of atherosclerosis. That's what I'm going to say now about diet. Again, I discuss it in much more detail. I'm going to have a couple of upcoming articles in my Applied Metabolics newsletter discussing a lot of aspects of dietary prevention of cardiovascular disease that isn't generally known by most people, including most physicians. And that's going to be in Applied Metabolics. But the underlying basis of most cardiovascular disease is a process called atherosclerosis, which involves the formation of plaques in the arteries of the body. Just briefly, an overview of what happens there is you start to get an accumulation of what they call modified low-density lipoprotein particles. Low-density lipoprotein is a protein or a substance manufactured in the liver whose primary purpose is to transport cholesterol in the blood. But what happens is sometimes when it gets oxidized in the blood, a number of things cause it to be oxidized. Exposure to free iron, there's a lot of reasons why, but once it's oxidized, it changes, and now it becomes more or less toxic to the lining of the blood vessels. And what happens is the body senses the oxidized LDL, and there's different types of LDL. They have small LDL, small dense LDL, large fluffy LDL. They found through studies that the small dense LDL particles are much more prone to oxidation. Therefore, they propose a greater risk to cardiovascular disease. The large fluffy LDL is much less prone to oxidation. Strangely enough, the way to increase large, fluffy, or the more protective LDL is to consume fat, believe it or not. Saturated fat actually promotes the better kind of LDL cholesterol, which a lot of people would argue with, but that's just a medical fact. Anyway, when these oxidized LDL particles accumulate, white blood cells called macrophages ingest the modified LDLs or the oxidized LDLs. They ingest them to try and get rid of them. But what happens is once the macrophages ingest the modified LDLs, you get this thing called foam cells form. In other words, the macrophages turn into foam cells, they're called, because they look like kind of almost soapy, foamy cells. But these foam cells are the beginning of what they call fatty streaks in the coronary or any arteries in the body. And the fatty streaks are the beginnings of atherosclerosis. What happens next is the body senses these fatty streaks forming, and it puts what they call a fibrous cap on top of the fatty streaks. So now you got a little bit of a kind of a bulge in the that's starting to block the artery, consistent of this fibrous cap. Eventually, the fibrous cap starts to thin out, and you get what they call a necrotic core formation within the fibrous cap. This eventually leads to a type of plaque. The plaque is basically atherosclerosis, starts to occlude the artery, but not completely. Very often, the most heart attacks and strokes are precipitated when a piece of the plaque breaks off and forms what they call a thrombus, which is a kind of a blood clot that can travel, or it actually stay in the same place. The thrombus can actually block a coronary or in the heart and obstruct the blood vessel. That's when that's a heart attack. That's a myocardial infarction. Now, the question remains, is there any preventive technique other than exercise and diet where you can know where you stand from a cardiovascular viewpoint? The average physician, if he was sitting here, would say, and I'm not a physician, but I'll say it anyway. I'm not a doctor. I only play one on TV. But anyway, the point is that the average physician will tell you, if you really know how you stand from a cardiovascular health viewpoint, get a lipid, what they call a lipid panel. The standard lipid panel checks things like total cholesterol, low density lipoprotein cholesterol, high density lipoprotein cholesterol, and also triglycerides. That's it. These give you a good generalized picture. The problem with that is there are other, indices of cardiovascular disease that are not measured in the standard lipid panel, but these other indices could give you a really good idea of how you stand from a cardiovascular health point, to the point where knowing these, some of these are highly, highly predictive of heart attacks and strokes. And if you know you're abnormal in some of these areas, you can take measures to prevent them or lower them and possibly save your life. But you see, the point is, you'll never get that from the standard lipid tests. You can have good values. There was a doctor say, oh, your total cholesterol is great, your LDL's within normal range, meaning under 100. You have an HDL of 65, anything over 40 or is considered normal, so you're okay, pal. No, you're not. Very often, some of these other indices that I'm going to talk about could be abnormal. You could walk away thinking you're in good cardiac health because of those lipid panels, normal lipid panels, when in fact you're not. So exactly let's talk about, like I just mentioned, the process of atherosclerosis, right? What's elevated? What are the things that are elevated that aren't actually measured in the standard lipid panel, and yet are predictive of atherosclerosis and cardiovascular disease, heart attacks and strokes? Well, some of these elevated things which are not normally tested, LDL-3A and B. These are what they call LDL particles. They only measure in the standard lipid panel. They only they do a generalized measure of LDL. But LDL, as I said, is found in its different particle sizes. Some particle sizes are worse than others. Another thing that could be elevated with atherosclerosis is called LDL-4B. Then you have apoprotein B, lipoprotein small a, which is a kind of a form of low-density lipoprotein, homocysteine. which is a metabolite or a byproduct of the metabolism of methionine, which is an essential amino acid. Homocysteine attacks the arteries, literally causes it damage, which causes the process of atherosclerosis. See, the body always tries to repair the damage, and in doing so, unfortunately, atherosclerosis is sometimes initiated. Another test, indice that could be elevated when you have that indicates atherosclerosis is high-sensitivity C-reactive protein, which is an indication of localized, not generalized inflammation. In other words, it's not localized to the HS-CRP test, just tells you that you have inflammation somewhere in the body, but inflammation is strongly associated with atherosclerosis and heart disease. It's the very cornerstone of cardiovascular disease, is localized inflammation in the blood vessels. Then you have another thing that's elevated called Lp(PLA2), which has to do with clotting. Then you have triglycerides, which are the fats in the blood. Elevated insulin can cause damage. So a lot of people don't know that. Being hyperinsulin, such as people that are insulin insensitive or pre-diabetic, bodybuilders who like to inject insulin in them all the time, they don't realize they're damaging their arteries. They're setting themselves up for future cardiovascular disease. Now, the things that are low when you have atherosclerosis, these things are protective of atherosclerosis. That includes high-density lipoprotein C, high-density lipoprotein 2B. Again, there's different particle sizes with high-density lipoprotein. High-density lipoprotein is largely made of protein, also made in the liver. It's kind of like a garbage man of the blood vessels. It carries away, it locks onto excess cholesterol, carries it back to the liver, where the cholesterol is converted into bile salts and then excreted. That's the only way the body can get rid of cholesterol. It cannot burn it like it burns fat. So HDL is generally protective. However, recent research shows that super elevated HDL levels, such as over 100, and now the normal level of HDL begins at 40. Generally speaking, the higher your HDL level, the more protection you have. Ideal HDL level would probably be about 65 to 85, something like that. But again, as soon as you go over 100, again, this is called hormesis, meaning that something that's good in lower amounts starts to get bad when it gets to a certain point, and the health effects reverse. Now it becomes kind of toxic. That's what happens with HDL when it gets to be over 100. I saw a guy in a video the other day who was bragging about having an HDL of 108. This guy doesn't know, but he's in trouble. He's heading for heart disease. But the other thing that's very protective is having a good level of activated vitamin D called 25-hydroxycholecalciferol. That's also very helpful in preventing cardiovascular disease. There, the minimal healthful levels begin at what they call 30 on a 25-hydroxy test. Starts at 30. Ideal levels are like 60 to 70. It only becomes dangerous, meaning too much vitamin D, when it gets over 100 for consistently. You'd have to take a whole load of vitamin D to cause that to happen. Now, what happens? What's the treatment if you have some of these things elevated? If you have an elevated LDL cholesterol or elevated apoprotein B, that's the protein backbone of LDL cholesterol. That's the basic structure of LDL cholesterol, and when it's elevated, it usually indicates higher LDL cholesterols. The relative risk for cardiovascular disease with this elevated LDL is 2 to 3 times above normal. How do they treat LDL cholesterol? With statins, niacin, fibrates. These are different kinds of drugs. Cholesterol inhibitor drugs, diet and exercise. I strongly suggest you try diet and exercise first. All of those other drugs all comes with side effects. Drugs don't work unless they have side effects. That's the way it works. What's the healthful levels? The healthful level of LDL is again below 100. You want to have an apoprotein B level of less than 60 milligrams per deciliter of blood. Another thing is, what do you do if you have the elevated small dense LDL, which I mentioned earlier? That's the one that's more prone to oxidation, which causes a 3 times greater risk of cardiovascular disease and heart attacks. The treatment for that is again niacin, fibrate drugs. Statins only have a minor effect on small dense LDL. They don't do much for that. However, a lot of doctors will give them out anyway. Again, the best way to treat elevated small dense LDL is diet and exercise, and ironically, to increase your fat intake a little bit. Don't cut fat out. Low fat diets promote the production of elevated small dense LDL. Not good. What's the goal you start looking for? You want to have LDL3 A and B. That's what they're called. You want to have them below 15% of the particles. Another one is called having low HDL2B. As I said, HDL is protective against heart disease. Having a low HDL2B increases your risk of heart attack 3 times above normal. The treatment for that is niacin, diet, exercise, stopping smoking. A little bit of alcohol helps, no more than, let's say, 2 glasses of wine a day, or beer. What's the normal level? HDL2B, it should be 20%, above 20% in men, and above 30% in women. Then they have something called elevated LP small a. That's elevated lipoprotein small a. Again, this is kind of similar to a low density lipoprotein, but it increases the chance of cardiovascular disease and heart attacks 5 times above normal. Most people never measure their lipoprotein small a, and if it's elevated, you're heading for a heart attack or a stroke. You won't even know it because your other lipid panels could be perfectly normal. There's no indication of LDL. However, I should amend that. If your normal lipid panel shows a really super elevated LDL, just a normal LDL test, let's say it's 150 or something like that, then that's a good indication that you also have elevated lipoprotein small a, because there's a correlation between LDL and lipoprotein small a. How do you treat it? Niacin. And there's a drug called fenofibrate, which has an extremely limited effect on elevated lipoprotein A. Niacin's about the only nutritional way. Of course, exercise always helps. But those of you who like to use growth hormone, large amounts of growth hormone are known to dramatically increase levels of lipoprotein small a, which means that growth hormone, if you use it on a regular basis, I'm not talking about growth hormone replacement, I'm talking about the doses that bodybuilders and athletes use, 15, 20 units a day, these massive amounts. You're elevating your lipoprotein A. You're probably setting yourself up for a future heart attack or stroke. What's the normal level of lipoprotein small a? Below 30 milligrams per deciliter, or a decrease of 50%. Elevated triglycerides. Triglycerides are the fat that's found in the blood. They used to be considered no big deal, but now they know that elevated triglycerides are a precursor for very low density lipoprotein, which in turn is converted to low density lipoprotein. And that, of course, if the LDL becomes oxidized, there's your atherosclerosis. How do you handle elevated triglycerides? Niacin, fibrate drugs, fish oil. Fish oil alone can lower elevated triglycerides as much as 63%. That's probably the first thing you should do if you have elevated. Cut out sugar. The biggest thing, the major cause of elevated triglycerides in the blood is too much processed sugar. This is how sugar affects heart disease. Diet and exercise, of course. Anytime you exercise, you're going to oxidize triglycerides. You're going to lower them. You're looking for a triglyceride level of 150 milligrams per deciliter or less. Let's talk about a little bit more specific about some of these things I talked about. The small LDL particles, LDL3A and B, and LDL4B, they can cause a plaque buildup to progress much faster because they enter the artery wall more easily than the larger LDL particles. And again, these things are not tested for in the standard lipid. You can have these small LDL particles elevated. You're walking around like a time bomb. You don't even know it. Having too many small LDL particles is a powerful risk factor for a heart attack. Then you have the HDL2B, large HDL particle. This is just the opposite. The larger HDL2B, that's the large fluffy HDL, they help to clean the articles by picking up cholesterol, as I said earlier, bringing it back to the liver where it's degraded into bile. Having low levels of HDL2B can increase your risk of heart disease. You want to stop smoking, you want to lose body fat, and you want to exercise. All of these things will raise levels of HDL2B. And by the way, HDL come in different subfractions, just like LDL. It turns out that the form of HDL raised, or the form of HDL that's increased by alcohol intake is not as protective as the LDL that's raised by exercise. So, exercise is better at raising this protective form of HDL than drinking alcohol. Some people try and short circuit. I'm not going to exercise, I'm just going to drink wine. Forget it, it's not going to work. As I said earlier, insulin and constantly elevated insulin levels tend to cause damage to the arteries. And again, you can control insulin. Best way to do it, low carbohydrate diet. Low carb completely controls insulin. Protein increases insulin, but not to the extent where the insulin causes damage. Then you have this. There's a test you could do. It's called the NT-proBNP. This test for stress on the heart. BNP. That's a hormone released from the heart muscle when your heart is under tremendous strain. It's a warning signal that your heart is being overworked. Early identification of high levels can help you decide, undergo treatments to prevent you from dropping dead of a heart attack. I mentioned vitamin D. It also has a cardiovascular protective effect. Apoprotein B and the LDL particle number. Apoprotein B is a direct measurement of the number of lipoprotein particles, including LDL, intermediate density lipoprotein, IDL, and very low density lipoprotein, or VLDL. A high apoprotein B number indicates increased risk for heart disease. You want to, again, eat clean, don't eat a lot of processed sugars, increase your exercise, and lose body fat. And all those things will increase apoprotein B. Again, lipoprotein small a, 5 times greater risk of heart attack if it's elevated. Basically, what it does is it increases the chance of a clot forming in your blood, and basically blocking let's say a coronary artery or an artery in the brain, and you get a stroke. Homocysteine, again, is a byproduct of methionine, and it directly attacks the coronary arteries. The way to handle homocysteine is to neutralize it by consuming certain nutrients, vitamin B6, folic acid or folate, and vitamin B12. They all neutralize homocysteine into a harmless substance. Get rid of it. If you're not taking in those nutrients and you're eating protein, high protein, you're going to have an elevated homocysteine. You're causing silent damage that's going to eventually give you a heart attack or stroke. LPPLA2, that it's an when it's elevated, it indicates your arteries are inflamed. As I said, inflammation of the arteries is the main risk factor for strokes and heart attacks, and it's related to high blood pressure too. High sensitivity C-reactive protein, again, it's a generalized measure of inflammation. Things that can cause inflammation include heart disease itself, allergies, diabetes, cancer, burns, arthritis, flu, foot and leg pain, injury, and infections. If you have any of those things, your high sensitivity CRP is going to be elevated, so it's not necessarily related to what's going on in your arteries. You have another test is for fibrinogen, which is a inflammation marker and clotting factor. Fibrinogen is part of the blood's clotting process, and when your arteries are elevated, when your arteries are inflamed, unfortunately fibrinogen goes up, and that increases the risk of internal clotting, which again, blocks the artery. There's your heart attack and stroke. You want to control fibrinogen by, again, stop smoking and losing excess body fat through exercise. There's a bunch of other tests, genetic tests. I don't think I want to go into it here, but the whole point of this video is I wanted to discuss some of these kind of, let's say, off the road cardiovascular tests that can give you a very true picture of how you stand in terms of cardiac risk. I would strongly recommend it if under certain conditions, especially if you, for example, have a high background or rate of cardiovascular disease in your family. If your immediate relatives, your father, mother, or whatever, brother, if they had heart disease, you should really get these additional tests. If you're an athlete and you're using anabolic steroid drugs in high amounts, you should definitely get these tests, because the biggest cause of death from using high-dose steroid regimes is cardiovascular complications, such as a heart attack or stroke. knowing how you stand through these they generally tend to call them the Berkeley heart tests, these kind of off the road tests. They'll tell you exactly how you stand as far as risk, and you could be proactive. You can make changes in your diet, exercise, maybe lower your steroid intake or whatever that will keep you alive, prevent you from dropping dead, as has happened to a lot of people that kind of ignored this stuff. So that's about it for the, if you want to call it off-the-road heart tests. They can save your life. I think they're extremely important. They might be a little bit more expensive, but you got to make a choice. Do you want to spend a couple of $100 or whatever it is for these tests, or do you want to walk down the street and drop dead? You have the choice. It's kind of like the COVID vaccination thing, controversy that's going on, where people, they say, well, you have your choice. You can either get the vaccination and live, or you could not get the vaccination and counter the virus and either get sick, die, or have permanent complications that could last the rest of your life. So it's a very clear choice, basically. And I'm sorry if it sounds political. All I do is basically quote science. This is not my opinion. This is established science. I'm not taking any political stance. If you want further information on nutrition, exercise science, anti-aging research, fat loss techniques that really work, ergogenic aids, hormonal therapy, women's health and fitness, supplement science, which supplements work, which ones don't. I am not associated with any supplement company, so I'm going to tell you the 100% truth. I've seen videos where they're talking about the truth about pre-workout or the truth about protein supplement. You watch the video, then it turns out that the guy is selling a pre-workout or a protein supplement. The whole video is basically a disguised advertisement. I mean, I'm not like that. I'm not trying to sell any product. I have no axe to grind. I'm going to tell you the truth. Also, I have almost 60 years of training experience. I know what works and what doesn't. I impart this in my Applied Metabolics newsletter. It's 40 to 50 pages. It's probably the biggest bargain you'll ever see on the internet. I mean, it costs less than a daily cup of coffee at one of these coffee places. The fancy coffee. It's cheaper than that. Cheaper than a daily newspaper. This newsletter can literally, or I don't like to call it a newsletter. It should be like a digest. I happen to choose the word newsletter because most news are just like 2-page pieces of crap that don't teach anything. They don't teach anything. This thing is 40 to 50 pages of extremely in-depth information. No matter what your level of education, you will learn something from reading Applied Metabolics. What else can I say? Subscribe today, www.appliedmetabolics.com. If you subscribe, I'll try and send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, and medicine, only for current subscribers of Applied Metabolics. I have an email portal, my Applied Metabolics webpage, where current subscribers only can submit short questions to me, which I'll answer. It is limited. I have some subscribers who, for some reason, they try and send me anything that pops in their mind. They shoot an email to me, and sometimes this is like 10, 15, 20 questions a day. Listen, for $10, you're not going to get unlimited questions answered. There's no one on this entire planet that would do that, and I'm not going to do it either. I have other things to do. I mean, if you want in-depth information that goes beyond, let's say, 3 or 4 questions a month, then you can have a consultation with me, which will require, that's a fee. I'm not going to be, I have to say this because it's happening. There's a couple of guys, they're abusive. It's the only word I can think of. I mean, I'm answering questions of the subscribers as an added benefit of their subscription because I appreciate their support of my work. I don't think anyone else who has a digital newsletter does this, as far as I know, or digital publication. They don't personally answer questions. But I do as a service to my subscribers because, again, I appreciate their supporting my work. So that's about it. If you want to have if you want to get the best friend you'll ever find, ever know, go to your local shelter, adopt a dog. I just read something the other day, just tangentially. The local animal shelters here where I am are actually not accepting dogs because they're so full up with dogs that they're telling people not to bring dogs to the shelter. So I don't know if that's a good thing or a bad thing, because unfortunately innocent dogs are killed in shelters, which is very heartbreaking. That's a whole different topic I won't get into, but adopt a dog. They're great. Take care. Thanks for listening.